Have you ever felt a physical change in your body? Maybe a feeling of heaviness, a sudden weakness, or a sort of looseness that you just can't quite explain?
Yeah, that vague sense that something's just off.
Right. It's the kind of thing where you might wonder if it's simply a permanent part of aging. Or, maybe you've assumed it's just your new inevitable normal after recovering from childbirth.
Which so many people do,
We
unfortunately.
really do. We tend to accept these shifts as permanent structural damage. We think the physical hardware of our bodies has just been permanently stretched out, and, well, that's that.
But that assumption is exactly what we're challenging today.
Yes, because today's deep dive is exploring a fascinating and honestly highly misunderstood question. Can nerve recovery actually improve perceived tissue laxity in the pelvic floor?
It's a question that completely reframes how we look at physical recovery, especially for women. I mean, we are so used to thinking mechanically about our bodies, like levers and pulleys.
Yeah, the old structural model,
Exactly. But the reality of how we feel our own internal structures is much more electrical.
which is wild to think about. And to figure this out, we're pulling from a really fascinating stack of research today. We've got everything from the latest British Menopause Society guidelines and advanced physiotherapy protocols to some genuinely cutting-edge clinical trials on electrical nerve stimulation.
There is a lot of really compelling data in here.
There is. So our mission today is to unpack the hidden electrical wiring of the human pelvis and discover why feeling loose might actually be a software issue with your nerves rather than a hardware issue with stretched tissues.
It's a game changer for how you view your own anatomy.
Okay, let's unpack this. Setting the stage here, according to the research, up to 58% of first-time mothers report sexual dysfunction a year after childbirth. And vaginal looseness is cited as a primary concern.
Yeah, that is a staggering number of people feeling disconnected from their own bodies.
It's huge.
And many of them are suffering in complete silence because they think nothing can be done. Or they are told by well-meaning practitioners to just, do more Kegels.
Right, the classic advice, just squeeze.
Exactly. The problem is, our sources reveal a fundamental misdiagnosis happening at scale in clinics everywhere.
Wait, hold on. If someone is telling me their tissues feel permanently stretched out, how can you say that's a misdiagnosis?
Hmm.
Like if a person physically feels a lack of support, what is actually happening in the body if it isn't just stretched tissue?
Well, that's the core of the illusion, right? Dr. Farzana's clinical guidelines in our stack break down a crucial distinction here. There's a massive physiological difference between structural tissue laxity and neuromuscular weakness.
Okay.
The issue is that the patient often experiences these two distinct issues as the exact same symptom.
So they feel the exact same, but the root cause is completely different. Let's dig into that. I'm trying to visualize this. What physically separates the two? Are we talking about like a worn out rubber band?
A rubber band is close, but let's use a hammock. I think it illustrates it better. Structural laxity is purely mechanical. It occurs when the collagen and fascial fibers within the mucosal wall have been physically overstretched or torn.
Okay, so in the hammock analogy.
In our analogy, the actual canvas of the hammock has been stretched out and frayed. The physical matrix is completely altered.
Oh, got it. So the canvas is basically ruined. What's the alternative then? Neuromuscular weakness.
Right, which the literature often refers to as levator ani incompetence. That's referring to the main pelvic floor muscle. This is when the muscles lose their active resting tone because the nerve signaling has been altered or damaged.
So the nerves are the problem, not the muscle.
Exactly. The muscles themselves are perfectly intact. The canvas of the hammock is pristine, but the trees holding the hammock are leaning inward because the ropes lost their tension. The whole system just sags.
Wow. Okay, so the canvas is technically fine, but it feels incredibly loose to the person because the baseline tension is gone.
Yes. And this distinction is vital because treating one condition with the methods meant for the other is a complete recipe for frustration.
That makes sense.
If you have true structural laxity, a frayed canvas, just doing muscle squeezes isn't going to magically repair torn collagen.
Right, the fibers are already ripped.
Exactly. But conversely, if the ropes are slack because of a nerve issue, no amount of thermal laser therapy aimed at the tissue is going to fix the underlying electrical weakness.
This makes so much sense. I mean, this is exactly why you or someone you know might be doing Kegel exercises religiously, literally squeezing those muscles at every single red light, but seeing absolutely zero change in that feeling of looseness.
Which is so frustrating for patients.
It has to be. Because the muscles themselves might be highly capable of a strong squeeze, but the baseline signal telling them to hold their everyday tension is just broken.
What's fascinating here is that we constantly try to fix the software glitch by patching the hardware. If the baseline signal is broken, the structural fixes just won't hold.
Okay, so if these nerves are essentially the electrical grid of the pelvis, what's causing the blackout? Is it always a traumatic event like childbirth?
Not always, no. Sometimes it's a slow, quiet suffocation of the nerve. We need to look at the anatomical culprit here, which is the pudendal nerve.
The pudendal nerve. Got it.
Yeah, it's the main electrical cable for the entire pelvic region. It originates from the lower spine, specifically the S2 to S4 sacral nerve roots, and takes a really complex journey through the pelvis.
Oh, right. It passes through that tight space, Alcock's canal.
You got it, Alcock's canal. From there, it branches out to supply sensation and motor control to the genitals, the sphincters, and all the pelvic floor muscles.
And the sources detailed two distinct ways this vital cable gets injured. One is compression, and the other is traction neuropathy. Compression sounds like that slow suffocation you mentioned.
It is, yeah. Compression is constant, lingering pressure on the nerve. We see this often in individuals who spend prolonged periods sitting or in avid cyclists, actually.
Cyclists, like from the bike seat.
Exactly. The pressure of a narrow bike seat directly against the perineum basically pins the nerve against the pelvic bone. Over time, that constant physical pressure restricts blood flow to the nerve, leading to irritation, numbness, and eventually full-blown dysfunction.
Wow, okay. Then there is traction neuropathy, which the sources associate heavily with childbirth. And honestly, the mechanics of this are pretty intense to read about.
They are. During a vaginal delivery, especially a prolonged second stage of labor with significant pushing, the baby's head descends and forces the pelvic floor to stretch immensely.
And the nerve gets caught up in that.
Right. The pudendal nerve isn't just stretched, it is forcefully compressed against the bony ischial spine and stretched far beyond its normal anatomical limits.
So imagine pulling a thick charging cable tightly around the sharp corner of a heavy desk, and then leaving it under extreme tension for hours. Eventually, the protective casing stretches, the wires inside begin to fray, and it just fails to carry a consistent signal.
That captures it perfectly. The nerve is deeply traumatized, and the result of that trauma is a state of profound muscular atony.
Atony.
Yeah, atony literally means a lack of normal muscle tone.
Let's break that down for me, because we usually think of muscle tone as, having defined biceps or something. What does tone mean in this specific context?
Under normal, healthy conditions, your pelvic floor muscles maintain a constant subconscious baseline tension.
Like an autopilot.
Yes, exactly. Even when you are completely relaxed, say just watching TV on the couch, they are always slightly engaged. It's a low-level electrical hum that supports your organs and keeps the tissue taut.
Okay, so it's always on.
Right. But when the pudendal nerve undergoes extreme traction around that bony corner during delivery, it essentially goes offline to protect itself. The muscle loses that resting baseline hum.
Oh, wow. So if we tie this back to the core focus of our deep dive, the laxity or looseness a person feels isn't necessarily just extra room in the physical tissue.
No, it's not.
It's a numb, disconnected nerve failing to tell the muscle to hold its baseline shape. The muscle is just hanging there, completely flaccid, because the electrical signal has been silenced.
Precisely. The macroscopic structure of the tissue might be mostly intact, but without the nerve providing that constant electrical tension, the entire area feels loose, heavy, and unsupported.
Because the brain is trying to send the signal, but the frayed wire fails to deliver the payload.
Exactly.
Okay, so we have a frayed cable. We know the software is glitching. Do we just wait for it to heal on its own?
Yeah.
I mean, how do we actually restore that baseline tightness and sensation?
Well, historically, the medical advice was literally just wait and see.
Which is terrible advice.
It really is. But the Frontiers Review in our stack highlights a highly effective intervention. Transcutaneous electrical nerve stimulation, or TENS.
Wait, 10 ENS units? Like the little sticky pads people buy at the pharmacy for a sore lower back? How does that fix a deeply traumatized pelvic nerve?
It sounds too simple, right? But it comes down to bypassing the damaged pathway. When a nerve is damaged, the specific connection points on the muscle, they're called the motor end plates, they become dormant because they aren't receiving a signal.
Oh, so they just kind of go to sleep.
Right. 10NS delivers selective electrical stimulation through the skin that directly depolarizes those motor end plates.
Okay, let me make sure I follow. If the nerve is the power cord and the muscle is the TV, the motor end plate is the plug on the back of the TV. The 10NS unit essentially bypasses the frayed cord and pushes power right into the plug.
Yes, exactly. It forces the traumatized muscles to contract and stay active from the outside, while the internal nerve itself takes the time to heal.
So you're jump-starting the system.
You are. And the parameters used for this are incredibly specific. It's not just a random shock.
Yeah, the research emphasizes that the frequency of the electrical pulse matters immensely for what you were trying to heal.
It does. Let's look at the biology of the muscle fibers. You basically have fast twitch fibers and slow twitch fibers. High 10NS frequencies, around 25 to 50 hertz, specifically target the fast twitch type 2 muscle fibers.
And why do fast-twitch fibers need a high frequency?
Because fast twitch fibers are designed for rapid, explosive responses. They are your emergency brakes.
Like when you sneeze or cough.
Exactly. When you sneeze, cough, or jump, those fibers need to fire instantly and forcefully to prevent leaks. High-frequency stimulation mimics that rapid-fire neurological requirement.
Ah, so we train the emergency brakes with high-speed signals. But that doesn't necessarily figure the constant feeling of looseness, does it?
Right, for the looseness, we need to look at low frequencies, around 1 to 10 hertz. These promote tonic endurance in the slow-twitch type 1 fibers.
Slow-twitch fibers are the costral fibers, right? The ones responsible for that constant baseline hum we talked about earlier.
That's the one. They aren't explosive. They are designed to maintain a low-energy contraction all day long without fatiguing. Low-frequency 10S slowly and rhythmically stimulates these fibers, reminding them how to hold that resting posture. Training those slow-twitch fibers is what directly combats that constant feeling of heaviness and laxity.
And the results in the clinical trials really back this up. 10NS is markedly more effective than standard pelvic floor exercises alone. It significantly improves what they call vaginal laxity questionnaire scores.
Yes, the VLQ scores go way up.
So external nerve stimulation directly and measurably improves the physical perception of laxity. That is huge.
And by keeping the muscle active and firing, tendinous actually accelerates the spontaneous reinnervation of the pudendal nerve. It speeds up the healing process, ensuring that when the nerve finally reconnects, the muscle hasn't wasted away from disuse.
Okay, so 10NS provides the external spark to keep the hardware from degrading. But eventually, the brain has to relearn how to drive the car itself. It has to reestablish its own internal communication with the pelvic floor, right?
And that is actually much harder than it sounds, because how do you train a muscle you can't even feel?
That's a good point.
There's a startling statistic from the Bioscientia Medicina review. Up to 30% of postpartum women perform pelvic floor contractions entirely incorrectly. When asked to lift and squeeze, they actually bear down, performing a Valsalva maneuver.
Wait, they are pushing down.
Yeah.
On a system that is already traumatized and struggling to hold things up, that sounds like it would actively make the problem worse.
It absolutely can, but it's not their fault at all. The pelvic floor is hidden from visual feedback. If you injure your bicep, you can watch your arm move and correct your form.
Right, you can see it working.
But when the pelvic nerve is traumatized, you literally cannot feel what those internal muscles are doing. You are flying blind. Your brain sends a signal, and it just hopes the right muscles respond.
Which is where biofeedback devices come in to bridge the gap.
Yes. Practitioners use internal sensors that detect tiny electrical changes in the muscle. They translate that invisible internal muscular tension into visible data on a screen.
So biofeedback gives you eyes on the inside.
Exactly. If you try to lift and you see the line on the graph go down instead of up, you instantly know your brain is sending the wrong signal. If we connect this to the bigger picture...
This is really about neuroplasticity, right?
Yes. It allows the motor cortex in the brain to close the sensory loop. It sees the mistake, corrects it, and relearns the precise neurological timing required to hold tension.
Which brings us to the concept of proprioception.
I was just going to say that.
This is one of my favorite concepts from the sources. Proprioception is often called the body's sixth sense. It's your brain's ability to map where your body parts are in space, even with your eyes closed.
Like how you know where your hand is without looking at it.
Exactly. But without nerve recovery, that sixth sense in the pelvis is just gone.
It creates a complete sensory void. You feel loose because your brain literally cannot map the boundaries of the tissue.
There's a brilliant analogy in the sources regarding our feet. So a human foot has 26 bones, 33 joints, and dozens of intrinsic muscles.
It's incredibly complex.
Right. If you walk barefoot on sand or uneven rocks, every nerve ending is firing, constantly adjusting the tension in your foot. But when we cram our feet into rigid, heavily cushioned shoes our whole lives, those nerves essentially go numb.
The brain stops talking to the intrinsic foot muscles.
Exactly. We lose the proprioception of the foot. The source argues that pelvic trauma does the exact same thing. It numbs the pelvic floor.
And restoring that nerve function, whether through 10S or biofeedback, brings that sixth sense back online. Your brain remaps the territory.
Which answers the big question of our deep dives today. Fixing the nerve fixes the perception of looseness.
Entirely.
When proprioception returns, the resting tone returns. The walls of the tissue engage. You literally increase the internal friction, the sensation, and that crucial feeling of tightness. You didn't magically shrink the physical tissue, you just woke the nerve back up and told it to hold its shape.
But as with all things biology, we have to talk about maintenance. We've established how to fix the software and restore the tone. But how do we maintain it, especially as we age and transition through phases like menopause?
Right. This is where we face the use it or lose it reality. The long-term data paints a very sobering picture here.
It does.
All those incredible short-term gains in tone, the benefits from biofeedback and 10NS, they dissipate if behavioral adherence stops. If you stop using the restored neural pathways, disuse atrophy sets in.
The muscle just wastes away again, and we have to layer the hormonal shifts of aging on top of this. The British Menopause Society's consensus statement on genitourinary syndrome of menopause, or GSM, shows how drastically the tissue environment changes as estrogen levels drop.
Yeah, estrogen deficiency causes the mucosal layer to thin out.
Right.
But what really caught my eye regarding laxity was what happens to the fibroblasts.
Oh, the collagen factories.
Right. Those are the specific cells that produce collagen in our connective tissue. As estrogen plummets, those collagen factories essentially go dormant.
And the existing collagen fibers undergo a process called hyalinization.
Let's unpack that term for a second. What does it mean for a fiber to hyalinize?
It means the collagen fibers fuse together and become rigid and friable. Think of an old rubber band that's been sitting in a desk drawer for 5 years.
Oh, I know exactly what you mean.
Right. It loses its snap, it gets stiff, and if you pull it, it just crumbles or snaps in half. That's what happens to the connective tissue. It becomes friable, easily torn.
So you lose the elasticity, blood flow drops, and the nerves are suddenly starved of the rich, oxygenated environment they need to function properly.
It's a double whammy.
It really is. The nerves are detraining from lack of use, and the physical tissue is literally drying up and losing its structural integrity like that old rubber band.
Which is why managing this requires a truly holistic intervention. You can't just do nerve rehab and expect a miracle if the tissue is fundamentally starved of hormones. The consensus is a combined approach.
Nerve rehabilitation with 10NS and biofeedback,
Yeah.
layered with direct tissue support.
Exactly.
The sources mention lifestyle modifications, like smoking cessation, because smoking aggressively increases the metabolism of estrogen and regular sexual activity, which mechanically stretches the tissues and forces blood flow to the area. But medically, localized estrogen is a primary treatment.
It is.
And there is also an interesting precursor hormone mentioned in the stack, DHEA.
Oh, DHEA is fascinating. It's delivered directly into the vagina, usually as a daily insert, and it works through a localized process called intracrinology.
Meaning the effects stay local instead of flooding the whole body.
Exactly. The epithelial cells right there in the vaginal wall take that DHEA and convert it directly into both estrogen and testosterone inside the cell itself.
Wait, testosterone too?
Yes. So you get the benefits of estrogen, which brings back moisture and mucosal thickness, but you also get the androgens from the testosterone, which actively stimulate the muscle layers and wake those dormant fibroblasts back up to produce fresh collagen.
That is incredible.
And because it's converted locally within the cells, you avoid massive systemic hormone spikes in your bloodstream.
It's treating the hardware and the software simultaneously. You feed the tissue locally, so it has the fresh collagen and blood flow to physically support the tension, and you maintain the electrical signal so the muscle knows to stay tight.
It's an ongoing, comprehensive maintenance protocol. You don't just fix it once, you maintain the grid.
So, bringing this all together for you listening, if you're feeling loose, unsupported, or disconnected from your pelvic region, whether that's after childbirth, during the chiss of menopause, or just from the wear and tear of life, it might not just be a permanent stretching of your hardware.
Most likely it's not.
It is very likely a sensory and motor disconnect, a software glitch. By recovering the nerve, whether through physical therapy, biofeedback, or electrical stimulation like 10NS, you can literally tighten the system and regain your body's sixth sense.
And I want to leave you with one final fascinating dot to connect from the research today.
Oh, lay it on us.
We've talked extensively about how sensory motor dysregulation causes pelvic floor issues, but did you know this shares a neurological pathway with restless leg syndrome?
Wait, really? Like the urge to move your legs at night?
Yes, because the lower spinal cord, specifically the L2 through S3 nerve roots, sends fibers to both the legs and the pelvis. The pathways are entirely intertwined.
Wow, I had no idea.
Because of this, some patients with pelvic dysfunction experience intense, restless sensations deep in their pelvis. It's driven by the exact same dopamine imbalances, central nervous system hyperactivity, and autonomic dysregulation that makes your legs twitch and kick at night.
That is wild. A feeling of looseness or pain in the pelvis and a restless twitch in the leg. They can be symptoms of the exact same glitch in the electrical grid.
It just goes to show how incredibly interconnected your nervous system really is.
It really does. Well, thank you for taking this deep dive into your own biology with us today. Remember, just because the hammock feels like it's sagging doesn't mean the canvas is ruined. Sometimes you just need to tighten the ropes.